Okay, so now we will discuss the treatment of mood or affective disorders. Mood disorders are categorized in the DSM as follows. There is depressive disorders. This includes major depressive disorder and dysthymic disorder, which is a milder, more chronic form of depression. There's the bipolar disorders 1 and 2, and the cyclothymic disorder, which also is a mild or more chronic form of bipolar. There are mood disorders caused by a medical condition, substance-induced mood disorders, and mood disorders not otherwise specified. So the goals for treatment of mood disorders include reducing or controlling the symptoms, and if possible, eliminating the signs and symptoms of the depressive syndrome. Also to improve occupational and psychosocial function as much as possible, and of course to reduce the likelihood of relapse and recurrence. Now, antidepressant drugs are usually the first-line treatment, and all antidepressants increase the activities of one or more of the following brain neurotransmitters: serotonin, norepinephrine, or dopamine. So some of the common classes of antidepressants are the SSRIs. Those are selective serotonin reuptake inhibitors. The SNRIs, serotonin and norepinephrine reuptake inhibitors. The tricyclics, the monoamine oxidase inhibitors, the MAOIs, and the NDRIs, the norepinephrine and dopamine inhibitors. So treatment for bipolar disorder is a little bit different. Normally they use mood stabilizers alone or in combination with antipsychotics or benzodiazepines. Of course, the goal is to reduce the likelihood of relapse and recurrence. There's additional therapies that can go along with the pharmacology, depending on a patient's needs. The other beneficial treatments for mood disorders include cognitive or behavioral therapy, family or marital therapy, stress management and coping. ECT, that's electroconvulsive therapy, is generally reserved for those unresponsive to medications, or milieu therapy.